Good morning, guys. Today we'll speak about a very nice case, which is also very typical. A basketball player, a woman, 14 years old. She had a trauma during gameplay. We did an MRI, and the MRI shows a couple of things. I will scroll down the images for a brief image of the trauma, the coronal here, and the axial. Okay, so let's talk about the obvious problems. Well, one of the obvious problem is this ligament, which is the anterior fibulotalar ligament, ATFL. As you all know it, it is thickened. Its structure is not intact at this point. You can appreciate, but not very well seen, on coronal here. This is the structure. It is completely torn and a bit retracted. This is why you see all these kind of fibrillar structures here, and you can see here also in sagittal. So this is a grade 3 ligament tear of the ATFL. I would like to show you a normal ATFL in order to understand how this ligaments look like in a normal person. This is a normal ATFL ligament, which is very thin, very black, and you can very well appreciate the integrity of the fibers. The other problem is that we all know from the biomechanical point of view that when we have a complete tear of the ATFL ligament, we need to search for the fibulocalcaneal ligament, or the FC. Well, the FC is this. It creates a hammock underneath the peroneal tendons, you see here, and you can also very well appreciate on coronal images, but not in this patient because it is also torn. You see here it comes. This is very thickened, and you see the attachment on the calcaneus and a lot of inflammation around it. And I wouldn't say it a grade 3 tear, but for sure it is a grade 2. Let's see how normal ligament appears. So the fibulocalcaneal ligament in a normal person looks like this: thin, black, underneath peroneal tendons. You can very well appreciate it also on coronal image. This is it. Maybe I will draw. It comes like this. Okay, and here this is the ligament on axial. You can very well appreciate, or you can better appreciate, ligaments in a normal person with non-fat sat sequences, because the ligament is surrounded by hypersignal from the fat. And take a look at this. This is the fibulocalcaneal ligament in a normal person. Of course, you know, you can see this ligament very well under ultrasound, and you can do dynamic maneuvers to prove that the ligament is in fact intact. And you do this by flexing the ankle, and you will see the peroneal tendon raised by the ligament who became stretched. Okay, back to our case. ATFL ruptured, grade 3, fibulocalcaneal ligament rupture, grade 2, posterior fibulotalar ligament, PTFL, looks quite normal in this patient, doesn't seem to be torn. This is the normal appearance on MRI with strands of hypersignal between fibers. This is normal, this is not a torn ligament. These are posterior fibulotibial ligaments, superior and inferior, and on the anterior part the syndesmotic ligaments, anterior tibial fibular ligaments, which are also intact. Let's talk about the other ligaments a bit later. What are we seeing in terms of bone? First of all, we see a very intense bone marrow edema in the lateral and plantar part of the cuboid bone, which actually hides a very small fissure, intraspongious fissure inside the cuboid bone. And you see this is close to the tunnel in which passes the peroneus longus tendon. You see very well on coronal images and also on axial images. Another area which gather our attention is in the talar head, the plantar part of the talar head here, which is a bone contusion. And from when we see this, we usually suspect an inversion trauma mechanism, and I will show you a picture a bit later about this. And you always need to search for the spring ligament. Well, spring ligament is a very complex structure, and I think I will have a dedicated lecture or tutorial for this spring ligament. So this is deltoid ligament, signal modification. There is bone marrow edema here, bone marrow edema here. Then you see the structure. This is tibialis posterior tendon, this is flexor digitoris longus, and these are fibers from the spring ligament and tibiospring part of the spring ligament. You see here there is a gliding zone between tibialis posterior tendon and superomedial component of the spring ligament. And if you look very carefully, you see there is bone contusion here, bone contusion here, and you see that this component of the spring ligament comes like a hammock around and underneath the talar head, and it will insert somewhere here, and you see there is no clear continuation of the fibers in this area. You can also appreciate this on axial images. On axial images you see this medial part of the fibers, and you don't see these fibers here very well. I have an image from literature with this. This is a very nice article for these guys from Basel, Switzerland, and of course they present all the anatomy in great detail. What I want to show, the general anatomy of this spring ligament. So I just show you the medial part of the plantar part of the spring ligament, and there is also inferior longitudinal ligament, which in our case is a bit torn. This is what I showed you. This is the superior medial part of the spring ligament. Okay, there is a small recess here which I will show you in a minute. This is the ligament and this is the recess, and maybe it's better seen on non-fat set. Here you see these are fibers from the plantar part, the medial part, and these are some fibers which seems to be torn on the medial, on the inferior part of the spring ligament. Okay, so when you see this combination of bone marrow edema in the talar part of, in the plantar part of the talar head, it most probably is also a spring ligament injury. There are other ligaments that you need to search when you see this trauma. Well, I will show you these ligaments first in an image. This is a different article. This is from AGR from 2018. Okay, Anna Hirschman. This is what I wanted to show you. This is the Chopard joint here, and this is bifurcate ligament, which has two components, calcaneonavicular and calcaneocuboidal ligament. There is also another calcaneocuboid ligament on the lateral side, and there is also a talonavicular ligament. And this ligament needs to be very carefully checked, because they might be torn. Not in this case. In this case I can show you the ligament between calcaneus and cuboid on the lateral side, and seems to be all right here. It's very well seen here, no inflammation. And then on the sagittal, but not very well depicted on these images, there is bifurcate ligament which starts from here and goes to navicular, this is one part, and goes to cuboid, this is another. This is a sort of an V-shaped ligament, and on the dorsal side there is a talonavicular ligament which looks fine. I have another case where these ligaments are very well depicted. These are the ligaments. I can only again show you the spring ligament components. This is deltoid ligament, the profound fibers. This is the superomedial component of the spring ligament. This is the gliding zone. This is tibialis posterior tendon, and the ligament comes and goes underneath talar head here. This is sustenaculum tali, I forgot to mention. This is a bony protuberance from calcaneus. Okay, and the bifurcate ligament we can see very well on sagittal images. Here, this is calcaneonavicular part. This is calcaneocuboidal part. There is of course other ligaments here between every bone in the tarsal bones, but they are intact here. And also in our case, what do you see? Again, another bone marrow edema, which are quite intense around here and around here. This is the anterior medial shoulder of the talus, and this is the posterior lateral shoulder of the talus. Fortunately, these are only bony bruise, no cartilaginous defects on the talar dome. So in conclusion, there are some problems here. There is talar head bone marrow edema due to trauma. There is spring ligament partial tear underneath here, where inferoplantar longitudinal ligament is torn, partially torn. There is ATFL completely torn, and also almost completely torn the fibulocalcaneal ligament. What else? There is a intraspongious fissure of the cuboid bone here with bone marrow edema. There is also edema on the talus posterolateral shoulder or anteromedial shoulder here. Keep in mind to look for the bifurcate ligament, calcaneocuboid ligament, and talonavicular ligaments, which are intact in this case. Looking forward to meet you again next time, when maybe I will have the time to explain the very delicate and complex anatomy of the spring ligament. Thank you for watching, and all the best.